Unfortunately, congenital heart disease still remains the #1 cause of birth defects in live babies, and about 1 in 100 to 1 in 110 babies are born with some type of congenital heart defect, so it's extremely common. Those can range from anything from a small hole in the heart that we can follow and hopefully close on its own to a significant defect that requires a surgery in the first few days of life.
In our team, we have people of so many disciplines. We have the cardiologist involved, we have the surgeon involved. Even if the child may not need surgery at some point, the surgeon may still be involved in helping us make that decision. We also have nutritionists involved, we have case managers involved, we have people who address all aspects of that child personality. So emotional, physical, mental, and of course the heart.
Surgeries that were impossible just 20 or 30 years ago, but now are possible and are accomplished successfully and safely. This institution provides very high quality care for any child born with any type of congenital heart disease that can be resolved through medication or surgery.
This hospital has the largest heart volume operation in the whole state of Florida. And there are very, very good surgeons here and diagnosticians, cardiologists and the like. They can hold their own with anyone.
We have the ability to really build from the ground up a totally new cardiac program, which allowed us to get the most state-of-the-art equipment, excellent staff, excellent surgeons, and really build it the right way. So we weren't entrenched in the old ways of doing things because it was a new program. They really held nothing back in building our cath lab, and it's allowed me to do procedures very safely with low radiation doses and minimally invasive type procedures. The nice thing for these kids is it's essentially a pain-free procedure, so they don't feel anything, they're asleep during the procedure, there's no scars, there's no stitches, and things that used to require an open heart surgery are now being replaced by things that we could do in the cath lab, so it's pretty exciting.
This hospital is remarkable in that, and the attention that is paid to the environment and the psychological atmosphere, the caring flavor, you can feel it as you walk through these walls. The old concept of the clean but cold hospital of the old days has disappeared.
When I walk into a room and there's a child who I'm going to be operating on, their parents, I always talk to the child first. I always sit them down and give them a bear, you know, a teddy bear, and then try to interact with them. And while I'm talking to them, I'm actually talking to the family as well.
Having a child with a congenital heart defect is a big deal, and it makes life difficult sometimes. Parents have to work, and we know that there's a lot of single-parent families and 2 working parent families, and it's sometimes difficult to drive into Orlando. We all know what the traffic's like. It is a lot easier for one of us to go out to the community and have a clinic that's more convenient for the patient, opposed to having a whole group of patients have to drive to us. And so we do have satellite clinics all over Central Florida, and it's a privilege to be able to go out to their community and provide this service to them, you know, closer to their home.
I know some people have an affinity for children, you know. I guess I'm one of them.